All right, welcome back to the podcast, everybody. On today's episode, we have a very special guest, Amber Margaretten. Amber, how you doing, ma'am?
Hey, good. How are you doing, Rich?
Great, thank you for asking. For those of us that don't know anything about you, can you share a little bit about yourself and how you help people, please?
Sure. Yeah, I am a master's level psychologist in North Carolina. I own Worry Free Psychology, which is a practice that focuses mostly on psychological evaluations, and we see both children and adults and take lots of insurances.
Yeah, that's awesome. Amber, who do you said adults and children. What are the concerns that they commonly come into your practice for?
Absolutely. It's really wide for us because we do have a few different psychologists that have different specialties. We can see people for reasons related to neurodivergence like ADHD, autism. Sometimes maybe kids or even adults aren't doing so well in school, concerned that maybe there's a learning disability present. So we can do some testing and figure out what's going on there and help out with accommodations. And then we can also see for broader reasons like bipolar-related disorders, psychosis, personality disorders, those types of things.
Wow, so it sounds like you and your practice can really help a wide range of people. Does that sound about right?
Yes, it does.
Wow. Yeah, that's really cool. Amber, when somebody comes in to do their evaluation or their assessment, what does that session look like?
Yeah, so it can look very different for adults versus children. For adults, if there's no cognitive concerns, we can see them virtually. So we usually ask people to block off about 2 hours, which will take care of the clinical interview as well as some testing. And then we may schedule additional appointments after that to follow up what that may look like. For adults that have some cognitive concerns, as well as pretty much all kids, we do an IQ test that would be in person, as well as other in-person testing. And then for kids as well, we usually schedule a separate intake session with the parents to go over background information where kids don't feel like we're talking about them, and parents can speak a little freely.
Yeah, that's awesome. Amber, some clinicians are, very driven, they're solutions focused. Others are very laid back. Some involve humor, some do some self-disclosure, others don't. They keep it very, very professional. How would you
Mhm.
describe your personality, so to speak, in the session?
Yeah, we have a good time. I mean, I definitely base that off of the client. If maybe a client is more literal, then I'm not going to be sarcastic during the session, right? That's not fair to them. But I do try to use humor when appropriate. Also, during assessments, being direct can be helpful. Sometimes people can get easily off track, and we only have a limited amount of time. So trying to redirect people back to, what we're trying to ask and trying to find out is definitely its own unique skill.
Yeah, absolutely. Amber, I like to kind of switch gears and ask about the assessment itself. Why is it important to get a really good and accurate assessment completed before a client actually continues with therapy?
Absolutely. So when someone's already engaged in mental health treatment and they're being sent over by a therapist, sometimes there's just something going on that the therapist maybe can't quite put their finger on, or the psychiatrist. And a formal evaluation can help figure out what is going on and then can help guide further treatment. As far as for children or anyone who hasn't been seen before, it's really helpful it really helps people get to know themselves. And for children, early intervention is super, super important. So making sure you have the correct diagnoses to help guide treatment and then connect them to resources is going to be really beneficial for them down the road.
Got it. And so let's say a clinician actually refers the client to get an assessment done. What happens to that assessment? Does that get sent back to that therapist? Do you collaborate with the therapist? How does that look?
This definitely depends on the client. Usually therapists will say, please send it back to me. But even if we have a release of information on file, we do ask the client or their guardian, do you want us to share this with a therapist? Sometimes, especially if something like trauma is present and maybe it is described in the evaluation, they may not want the full evaluation released. So then in that case, we can send a letter that says, hey, this client, appeared for psychological testing on this date and was diagnosed with X, Y, and Z. And then we'll provide some recommendations at that point to help guide treatment.
Got it. Amber, maybe you can provide some clarity on the difference between the assessments done at a therapist's office, because most do, like their first session is a
Mhm.
evaluation appointment or an assessment appointment,
Yeah.
typically 60 to 90 minutes, sometimes even up to 2 hours. So what's the difference between that type of assessment and the assessments that you provide?
That's a great question. So I know for like the initial CCA, right, done by therapists, those are really in depth. And that's pretty much what we do during the first part of testing. We're doing that thorough clinical interview, getting that background history. And then maybe there's some brief screeners in there, like the GAD-7 or PHQ-9 to gauge those any current anxiety or depression symptoms. The difference between like an evaluation or testing at my practice, I would say it's a little bit more in depth. We do use other measures that do require either a specific license or the questionnaires, instead of maybe being 7 to 10 questions, some of them are up to like 360 plus questions. So just super, super, I would say intense. It's just a lot more in depth.
Yeah, sounds like it's a lot more thorough. Do you find that clients are intimidated by the depth of these assessments? And if so, how do you kind of navigate that?
Yeah, absolutely. It can be really overwhelming. I mean, if you asked me to sit down right now and take a 360 question questionnaire, I would immediately feel overwhelmed. Like there's no other way to say that. And of course, some of the questions are vague, right? And they kind of force you into a true or false answer. So you have to pick one, right? But maybe it's not true all the time, and maybe it's not false all the time. So it can feel overwhelming, but that's why we like to make sure that they're doing those with us present, so that we're there for those questions and can make sure they're answering them appropriately. And then we take breaks. I mean, I definitely base that off the client. If you need to stand up, walk around, say that, right? Like you don't have to ask me for permission. Take whatever breaks you need.
Got it. Yeah, that's awesome. Amber, so then what is done with the assessment? Once it's all said and done and you guys process it or finalize it, like what happens then?
Sure. Ideally, we would inform the treatment team in some way, shape, or form, whether it's sending the entire assessment or sending some sort of letter showing that, hey, we did see your client, this was completed, and these are the results. And then based on the testing, maybe there are some things that we notice that could be beneficial for a person. So if they're struggling with something like handwriting, maybe they would benefit from an occupational therapy evaluation. Or if someone has some sensory sensitivities, occupational therapy could be helpful. Or if we notice a speech impediment, that's not my area of expertise, so maybe I'm referring to speech therapy at that point. So just trying to plug them to whatever resources we think they would need and set them up with their next steps.
Got it. Okay, so you're not just completing the assessment, you're making recommendations that could bring value to the client.
Absolutely. And for example, most of the recommendations do include, we think you would benefit from therapy and even possibly medication management. So then providing the client with resources like these places take your insurance, try reaching out to them, let us know if they don't have any openings and we'll connect you with more resources, that sort of thing.
Got it. That makes a lot of sense. Amber, what would you say that the feedback has been from clients that have worked with you in the past?
I feel like we've done a really good job with having positive interactions with clients. Of course, sometimes people may be shocked by results, especially if maybe they were coming in and only had concerns for one thing and more than one thing are present. We do try to manage those expectations as best as we can, so there aren't any like shocking findings throughout the process. But overall, I feel like both clients as well as other practices we've collaborated with have had positive experiences with us.
Yeah, that's great. And Amber, I know that, or at least I've heard from my experience that it can be tough finding, a practice or even a assessor that is good at what they do. I don't know why that is. Why do you think that is?
It can be so difficult. I know in the field, when there's just not as many psychologists as there are social workers, counselors, LMFTs, there are just more of the other profession. And then not all psychologists do testing, which even then further limits how many people are doing evaluations. And then on top of that, not everybody takes insurance, or some people are only self-pay, so you just continue to limit the field. I know that there's such a high demand. What I could imagine is happening is maybe people are just trying to see as many people as they can, which then impacts the quality of their testing services.
Got it. That makes a lot of sense. Amber, I'd like to switch gears a little bit and ask about you. Is that okay?
Sure.
What motivated you to enter this line of work?
I have always been interested in why people behave the way they do or experiencing the things they do. And that really got me interested into psychology. And then while I was obtaining my 4-year degree, I worked in a residential treatment facility for people with intellectual disabilities as well as autism. And then some even had dual diagnoses with mental health. And that just further let me know, hey, I need to go on to grad school, get some sort of license so I can continue to do what I love.
Yeah, that's really cool. Amber, what do you do outside of the office?
I really like to travel. You propose a trip, and I'm like, let's go. Let's plan it right now, Rich. I'll get on the plane
Where are the
next
tickets
week.
at?
Yeah, love it. I also have a family, so I love taking bike rides. I take the dogs for walks, those sorts of things.
Yeah, awesome. Amber, if somebody wants to reach out to you and partner with you in your practice, how can they do so?
Sure. Email, I highly suggest that. It's the easiest way to reach us. Our email is info@worryfreenc.com, and NC is like North Carolina. We're also on Facebook and Instagram. On Facebook, it's Worry Free Psychology, and then Instagram, it's the @worryfreenc.
Amber, yeah, thank you for sharing that. And thank you for being on today's show.
Thanks so much.
Yeah, absolutely. And everybody else, thanks for tuning in. And until the next one, signing out. Bye.
Bye.